just told this story to somebody and they asked me to document it. Um, this is about a session that I just did today, and it's not atypical with regards to some of the areas that I work with generally, but it's special because I learned something new today, and it was also special because it helped somebody resolve something that I think really dates back to birth, you know. So I'm going to tell the story of the session kind of blow by blow, and then I'll give you the backstory about the client and some of the history of the care that they've received already. So the client is a 21-year-old female. Until recently, she was a college-level soccer athlete, and she suffers from some GI issues that have incrementally become pretty severe. So it's very much limited her diet. They've even had to sort of do some kinds of medical dietary supplementation stuff for her in the recent past. But in the immediate situation, she had a lot of upper GI distress, which we managed to resolve a little bit. And so she came in today complaining more generalized discomfort in middle GI, which worsens in the evening as her metabolism slows down. It results in bloating at night and a lot more distress, and so difficulty sleeping. And she does a program, a home exercise self-care program, what I've given her, which usually has some pretty good impact, but she found that none of the things that I've taught her were really helping her with any of this stuff that she's getting right now. So I start off just asking her to point out where the restrictions were. She kind of indicated small intestine more on the outside edges than central. And she also indicated that she was having a hard time really getting her posture to be erect. And over the last few days, the posture sort of gradually worsened. Shoulders have gotten rounded, her lower back has become arched, and she can't really get her pelvis to tip back and be level. So I was thinking about the fact that since she has actually been able to eat more frequently, that perhaps the distress in the small intestine was related to the fact that she's actually having to do digestion more frequently. And so I just kind of went through the process of digestion in my mind. Sort of food enters the small intestine. I asked her if she had distress immediately after eating. She said no. Within a short time after eating, she said no. So I didn't think it had to do with actually food entering the small intestine. So then I explained to her how, the second phase of digestion after food's actually broken down is that more blood arrives into the small intestine to actually uptake the nutrients. And as soon as I said more blood, I could see her face kind of fell. And so I asked her, does the idea of having more blood and more weight in the small intestine actually distress you? And she said, yes, it's a very unpleasant thought. So that indicated to me that that she may have some difficulty with circulation, and I wondered, how I might kind of help her differentiate the tissues within the small intestine area, as the peritoneum itself, the small intestine material itself, the visceral smooth muscle, and then the blood vessels that infiltrate all the fascia through the mesenteric. So that kind of brings me to the technique that I ended up using. I was sort of started at the aorta, I was just sort of feeling through and could feel there was a good bit of tone, not a lot of oscillation along her aorta. Whenever I did small micro movements to encourage movement, it was very resistant. So I wanted to kind of find a way to invite her to bring more movement into that aortic and then the secondary and tertiary blood vessels. And so the method that I used with her was a visualization method that I actually did internally. I saw a documentary a few years ago of undersea event where at night corals that are encroaching on each other will actually literally spill their guts out and try to digest each other in order to gain territory. And the film actually showed these viscera essentially coming out of their housings and crawling across the surface and interacting with each other. And it gave me a very sort of tactile sense of what the density is and the movement quality is of the smooth muscle that makes up our intestines. So I've kind of memorized that little video, and I use that little visualization to model back to the body, like, this is what your movement should look like. And so the other thing that I do visualization-wise is I'll sort of have two hands on the body, and one hand will sort of belong to one set of tissues, the other hand will belong to the other. So that kind of anchor. And so I basically had my top hand be the small intestine, and I invited it to do that kind of movement, and it was able to do it fairly readily. And then I invited my bottom hand, which is under her back, which sort of belonged to aorta and the blood vessels, to also do that kind of movement, and it could not do it very well, but it started to try. And what I found was that the areas in the small intestine proper were able to pick up that movement pretty quickly. It's capillaries, pretty small vessels. The tissues in the mesentery, which are heavier, had a harder time making the change. And I finally got to see that there was a fair amount of change, but there were just certain areas on the left lower quadrant particularly that were not managing to change despite a lot of other areas starting to change. She was feeling lighter and more comfortable in a variety of areas, but there was one area that just on the left lower quadrant, as I said, that wasn't improving. She said that that's historically a tougher place for her. She's accustomed to feeling discomfort there when other areas are feeling good. And so I stopped for a moment and went to my phone, Googled venous return from small intestine, and I got a little diagram of all the primary veins that leave the small intestine. There was one particular one that stood out to me. It's the inferior mesenteric vein. And when I traced the line in her back along that, she indicated that that's sort of a familiar area to her that's very uncomfortable. And again, I went through the visualization process. It was much harder for this tissue to actually match that movement pattern, so I was able to do it very, very gradually until I reached the top of the vein, where it enters, I think, a splenic structure, a splenic vein. And at that juncture, it had a really hard time. It was as if it had never done that movement before. And that's what made me think that this dates back to infancy and birth. Because most tissues, if I kind of model for them their normal movement, they at least recognize it, even if they have a physically hard time doing it. Here, there was just sort of no sense of recognition at all. So I just waited. I basically went down the track a little bit, re-encouraged the nearby tissues to do that motion again, then kind of came back to this area that was having a hard time. So I kind of did almost like a bilateral balance kind of technique, modeling for it. Like, look, your neighbors just did it, you can do it. I'll wait. I'll let you have lots of time to figure it out. And eventually that area was able to make the shift. And after that, there was sort of a pretty global change in her motion, her respiration, her affect, and we more or less ended the session there. When I asked her how she felt when she stood up, she said that she felt an openness in that area that she had never felt in her whole life. And I could see that her gut had dropped back in towards the spine, her pelvis had righted, her back was open, her shoulders were open. she indicated the same to me, that she felt right again in terms of her posture. I explained to her, I showed her diagrams of what I'd done, and asked her to do a mudra. This one particularly, it says middle finger and thumb, middle finger being the meridian for pericardium and blood vessels. As soon as she did that, a weight came over her. It was pretty clear that she was not able to really manage that kind of pressure in that system. So I talked to her about modeling that image of the sort of micro movement in the viscera, and as soon as she kind of picked up that little picture and then did the mudra again, she was able to allow some flow through her system. So that was her homework, is that she has to sort of persist. And that was the session. The background is that she first came to me when she was 16 with low back pain that was chronic, and she'd had physical therapy, had been seen by orthopedists and examined and MRI'd and all this stuff, and they just couldn't really find any reasons for it, and so she was sent to me in the hopes that something might be done. And at that time, I did standard phase 4, phase 5 work with her lower back, and she had some significant improvement. So she would come back to see me once every 3 or 4 months as things would kind of tighten back up, or when she would have particularly intensive periods of playing her sport during competition times or things like that. And then around the time that she was 18, her left hip started to become really painful, deep pain. They suspected perhaps she had a labral tear, so they did MRIs again. She did not have a labral tear. She just had this very tight hip. I started to see her again. At this point, I had started to do more visceral work, and I noticed that she had some visceral limitations, which we worked on, and her hip pain improved over time. Her hip pain would return from time to time depending on her level of activity, it seemed, but as her time in college went on and her stress level went up, it became obvious that really her hip pain and the incidences of it really seemed to relate more to her GI issues, and her GI issues kind of became more extreme. But she was away, so I kind of would see her when she would come into town, and mostly just was teaching her how to do visceral work on herself, and that helped her to manage her symptoms sometimes better than others. And then recently she's returned home, she's finished college, and we've been working more regularly. And I started to get the history of her GI issues, which apparently date back to childhood, and started off with her stomach. So I actually started to work with her lung and stomach tissue, particularly trying to differentiate esophagus from trachea, and then just have gradually worked my way down her GI tract, trying to establish normal movement little by little. So the process is still ongoing, but the positive, exciting thing is that she's able to respond, she's able to propriocept these things, and look at anatomy charts and videos, and use that input to use to do self-care for herself in a way that's pretty clear and effective for her. She's actually interested at this point in pursuing this kind of work and training in ortho-bionomy. All right, so I hope you found that interesting, and this is the nature of my work, and relates to the kind of material that I teach in my classes. Thanks.